Good day, everyone. My name is Okpeyemi Akonle. So my topic for today is using Shimmer Sensors in post-myocardial infarction care. So this is a digital health solution for improved patient outcome. So let's do some background research. So myocardial infarction is a leading cause of mortality worldwide. So what is the cause of myocardial infarction? So this is actually caused by you know, either total blockage or partial blockage of the coronary arteries. So these coronary arteries are the main vessel that actually supply oxygen and nutrient to the myocardium. So when there is blockage or any issue with this vessel, the heart will not be able to get enough nutrient oxygen, so leading to ischemic changes in the heart muscle. So this will further lead to, you know, hypoperfusion to other organs like the brain and other major organ in the body. So after MI, careful recovery monitoring is needed to prevent complications like arrhythmia, it might be tachyarrhythmia, bradyarrhythmia, heart blocks and the likes, and also heart failure. So these are the most serious complications after myocardial infarction. So the traditional method of monitoring these patients actually creates gaps between the clinician and the patient. So because the clinician cannot actually monitor this patient while they are at home. So which brings us to this process of monitoring this patient in real life after myocardial infarction. So the objective of this project is to utilize Shimmer sensors for real-time monitoring after MI. So we want to check their vital signs on the real-time. Uh, so we check the heart rates, the blood pressure, the oxygen saturation, and ECG. That is the electrical activity of the heart, which is very, very important in this monitoring. So, for example, if there is any uh, issue with the heart rate, of course, these sensors will pick it up on time. Then the clinician can actually see what is going on with this patient, and prompt monitoring and evaluation can be made on time to prevent further deterioration or complication that might arrive later on. So the research question is, how can Shimmer sensors be utilized in monitoring and management of patients during post-myocardial infarction? So we want to see how we can utilize these sensors to monitor these patients in order to improve their outcome and recovery. So the methodology, so we're using 50 patients who are clinically stable between the age of 40 to 70 years, and they are recovering from, myocardial infarction. So we're going to recruit these patients from tertiary hospitals with informed consent, with in collaboration with the cardiologist as well, which are the primary uh, care provider to this set of patients in the tertiary institution. So the sensors that we're going to be using, we're going to use the Shimmer 3 ECG for the ECG and the heart rate. Then we're going to use the Shimmer IMU sensor to track their movement and physical activities. Then we're going to use the Shimmer 3 GSR sensor to monitor the physiological stress outcome. Then we're going to use the pulse wave blood pressure sensor monitor to monitor their BP. So the experimental design, so we're going to monitor these patients for 12 weeks, continuous monitoring. So we are going to monitor data which include heart rates, ECG, blood pressure, physical activity, and stress response. So we're going to monitor these patients both in the hospital and in their homes as well, so that we can compare both the hospital monitoring and the home uh, care environment. Then this data will be compared with traditional methods. So we're going to compare this data with the clinical ECG machine from the hospitals. We're going to compare the blood pressure with the traditional method of taking blood pressure in the hospital using the BP cuffs and the heart rates and all the sensors, all the vitals as well. So data collection and storage. So we're going to collect this data via Shimmer compatible smartphone app using Bluetooth. So data will be transmitted to a cloud storage system in real time so that the healthcare can access this data and use them to monitor and change the care for these patients and all. So we validate our data. So wearable BP readings will be compared with clinical BP curves. So ECG and heart rate will be validated against the clinical ECG devices, and statistical analysis will be assessed how sensor reading align with clinical measurement, just to compare these readings with the traditional method, and to notice maybe there is any discrepancy or differences between these sensors. So the analysis, so outcome to compare. So we want to see the recovery rate, the complication occurrence. So which we've talked about the arrhythmia, the hypertension reoccurrence, the heart failure, and some serious complications as well. Then we want to compare the speed of intervention between the control and the experimental group. So we want to see maybe there's a difference between how doctors react when they notice any changes in this patient vital and ECG readings. So we want to compare the speed of intervention between both groups. Then we're using machine learning model to identify patterns that correlate with recovery outcomes. So we want to develop the metric that actually identify the pattern. And yeah, so expected outcomes. So continuous monitoring provide real-time insight for early intervention. So we want to, see this patient gets real-time monitoring and early intervention to prevent any complication and any further deterioration in their health. So the challenges and considerations. So we want to make sure we comply with the FIFA and the PIPEDA privacy rule. So technology acceptance. So user-friendly design to help the patient, especially the older adults, to adapt to wearable devices. Then clinical integration, which is very important. So we want to train the staff, the clinicians and the specialists in the hospital, how to use and how to, interpret this data, and, system upgrade to actually integrate the data from the Shimmer sensor into the clinical workflow. Because if these data are not incorporated into the EHR, of course, the clinician might not notice when there is any changes going on with the vital signs, the ECG readings, and the rest. So integrating this data into the hospital workflow will, create a very big difference in this patient care and recovery time. So in conclusion, these projects, aim to improve post-MI care using wearable sensor technology. Continuous monitoring, we know will lead to a better recovery outcome. and fewer complications in this patient, like, the rate of developing irregular heartbeats, like bradycardia, tachyarrhythmias, and heart blocks and all can be spot on time, and early intervention can be uh, put in place. So further advancement in sensor can actually that can actually monitor the coronary artery to help prevent heart disease and spot early signs of blockage, leading to better outcome of this patient. So if we can develop a sensor that can actually monitor the coronary vessel itself, so this will help us to actually uh, interfere in taking care of these patients. So, for example, if a sensor can detect there is less blood flow going to the myocardium, of course we can actually place these patients on blood thinner like heparin, warfarin, that can actually, and aspirin as well, that can actually prevent this clot. And some patients that actually develop plaques in the coronary vessel, we can place them on statins that can actually lower the cholesterol level, giving us time to actually prevent further complication like arrhythmia, myocardial infarction, and and the likes. So that is for that. Then these are my references, and thank you.